It's just past 3:30 p.m. in North Carolina, and right now there's a young boy in an after-school daycare program as I speak. At 3 years old, notes began coming home from school about his behavior, and those notes quickly transcended into meetings with daycare specialists. And those specialists assigned a shadow to him. And a shadow is someone that followed him around, managing his behavior and his daily activities. He just started kindergarten, and his problems quickly persisted. So a doctor was consulted, and it was come to find out that he had attention deficit hyperactivity disorder, or ADHD. So what is ADHD? According to the Diagnostic Statistical Manual on Mental Disorders, 2004th edition, ADHD is any inattention, hyperactivity disorder, hyperactivity that is frequently displayed and more severe that is typically observed in individuals comparable level of development. What I'm going to be informing you about today is that numerous children are affected by ADHD, as well as they face challenges because of it, yet through treatment, there is treatment for it. Now that I have, now that we know that about ADHD, what is the prevalence and how is it diagnosed? This disorder touches many children in the U.S. and is typically diagnosed in early childhood. According to the Center of Disease Control, last updated in April 2009, 5 million children at ages 4 through 17 have ADHD, or 8% of the population. It is typically diagnosed between the ages of 5 and 6, and the symptoms are numerous. They have a difficulty listening when spoken to directly, organizing their daily activities, easily distracted, forget many things, fidget, talk excessively, run about excessively, and often interrupt. 6 or more of these symptoms must persist for 6 or months at a time. Teachers, friends, and family members also fill out specific surveys that doctors and psychologists use to diagnose the individual. This disorder is usually followed by complications and adjustments for all those involved. There are many challenges children with ADHD face, and typically they have a difficult time managing their daily tasks. So what a parent who has a child with ADHD will do is they will fill out a chart, something like this, with a few basic supplies. And what they do is they will list something like making the bed, picking up toys, homework, brushing teeth, and even taking a bath. And this is something that a typical child does not have difficulty doing, but a child with ADHD does. And they need numerous reminders as well as a visual such as this. And it's based on a reward system. So they get stickers, and after numerous stickers, they'll receive a reward. Now, also, family life is affected, and it's affected by divorce. Now, a child is never, ever responsible for divorce, but they usually bear the brunt of it. And Elias reports in USA Today of October 2008 that parents with a child of ADHD are 2 times more likely to divorce by the time that child reaches 8 years old. So a child with ADHD is 2 times more likely than a normal child to come from a broken home. Co-occurring disorders are often usually associated with ADHD. Harvard Mental Letter of October of 2008 states that co-occurring disorders are common. 54 to 84% of children with ADHD are affected with opposition-defiant disorder, as well as 54% of children with ADHD have learning disabilities. Miranda and Learning Disabilities of 2008 states that children with learning disabilities will struggle with special education, and also they will usually be expelled or suffer from suspension as well. Substance abuse is an increasing problem as well, especially with ADHD medication. Setlick reports in Pediatrics of September of 2009 calls to poison controls with regards to ADHD medication has risen to 76%. Even with the complications associated with ADHD, there's many methods of treatment. Treatment with ADHD is fought on 2 fronts. One is cognitive therapy, as well as medication. Now medication, there are stimulant medications and non-stimulant medications as well. Stimulant medications are used far more than the non-stimulant medications. You would think to stimulate a non-stimulated child would be counterproductive, yet Burke, through Development Through Lifespan, 2007, states that stimulant medication increases the activity in the frontal lobes, that's in the brain. There would increase the activity in the child's capacity to sustain attention and inhibit the off-task behavior. Cognitive therapy, both individually and as a family unit in conjunction with medication, is an expensive method, and most parents cannot afford it. Yet it is a very productive method. Now, there are some people out there that believe therapy alone, without medication, is another way to go. ADHD may be a mental disorder, yet for a child, it is life. The young boy I referred to earlier, his improvement is increasing and his focus at his school as well. He is on stimulant medication and is currently seeking a therapist. His name is Ethan, and he is my son. My hope is that the next time you see a child running amok, talking excessively, fidgeting, or you hear of a child with ADHD who has a co-occurring disorder with substance abuse or learning disability, you won't necessarily excuse their problem, but you'll now understand it and realize that numerous children are affected by ADHD. They face many challenges because of it, and yet there's treatment for it, and that through the love and the support of those around them. And that the 5 million children with ADHD can make an impact on our lives. As the ADHD successors such as Albert Einstein, Ernest Hemingway, and Sir Isaac Newton have done for all of us.